If you can hear people outside of that room making a lot of noise, it can also just plain be distracting or uncomfortable for you. Right? So like, how are you going to open up about your deepest trauma that you've never told anybody in your life if you hear people, clinking glasses and laughing from the other side of the wall?
Hey everybody, before we start the show, I want to make a couple disclaimers. This show does cover a wide variety of topics related to mental health and life in general, and some of those could be sensitive for you. I want to simultaneously encourage you to be brave in consuming difficult content, but also respect and recognize your limitations. So please use your best judgment. I will never be offended if you need to skip a question or an episode entirely, but feel free to feel it out, check out the episode, and just see what happens. If you need to skip, that's okay, but feel free to give it a shot first. I also need to say that while I am a psychologist, I'm not your psychologist, and I'm not your therapist. This is not intended to be direct medical advice, and you should not use this as a substitute for professional help. So with those said, let's go ahead and get into the show.
All right. Hello, friends of all varieties. This is the Hardcore Self-Help Podcast, episode 375. I'm your host, Dr. Robert Duff, aka Duff the Psych. I make mental health content for real people just like you. And today I have a question and answer episode. Two really interesting questions, kind of different stuff than I've talked about recently. If you would like to send me in a question, send me an email to duffthepsych@gmail.com or send me a contact form message on my website, duffthepsych.com. As I said, two interesting questions, nothing too serious here, nothing too triggering or potentially triggering. I wanted to update you guys and let you know that the podcast is going to be dark next week. I'm not going to be releasing an episode. I'll be doing family stuff. The kids are off school all week and have my dad coming up for Thanksgiving, and that should be fun. So yeah, no podcast next week, but thank you for listening now. And if you are in a position to be able to celebrate with your family or friends or loved ones, I hope that you have a really good time. And also I wanted to say thank you for the feedback from last week's episode. A lot of you reached out individually through, say Instagram or email to thank me for, what was covered in last episode and said that it was personally relevant to you. So I really appreciate that. Reviews are always great for the podcast, but even individual feedback, it's very helpful for me to know. And it, helps me know that I'm doing something good. There's a lot of metrics to judge yourself by when you have a podcast. There's downloads, there's ratings, there's sort of the status of the podcast. But, for me, as long as I'm making a difference for individuals, as long as I'm helping individual people with each episode, then I'm satisfied, then I'm happy. So thank you for letting me know about that. And the last thing that I want to update you guys about before getting into the questions here is something that is totally unrelated, but just sort of productivity-wise, something that's been great for me. You guys already know that I enjoy using ChatGPT, the AI chat bot, and they've made some updates recently. So if you haven't yet dove into that, or you did some but kind of backed off, now might be a good time to get back into it. They've updated a couple things in particular that have been very, very helpful for me, both in my clinical work as well as my work in, kind of making this podcast. One of those is the ability to make what they call custom GPTs. So custom GPTs are basically, custom instructions for a chat. And so for me, I made a whole kind of chat bot for the podcast. So when I'm done with this episode, I'll be able to plug my outline into that bot and it will turn it into kind of a blog post. It'll turn it into show notes. It'll give me the meta description that I need to put on my website and things like that. And so I gave it all the information up front. You can even upload documents. So I uploaded a document with examples of my writing style so it knows what my voice is, which is super, super helpful. And the other one is there's like this audio mode. I'm not sure what they're calling it, but you click a button and it allows you to talk back and forth with ChatGPT. And I'm not sure if I've mentioned this one already, but I've been using it to basically simulate mock interview questions. And I feel like that's a really, really good use of it by giving it a description of a job you're applying for or an internship or, even dating, small talk, whatever. I feel like I may have talked about this on a podcast previously. Apologies if I have. It's ringing a bell. But either way, you can have it actually speak to you, and the voices that it has are very good and understandable. And then you speak back to it and you kind of go back and forth like that. And it's something that I've been doing in the car or when I'm on a walk or something like that. And yeah, just a really good way to continue either practicing or getting information about something. So all of that preamble aside, let's go ahead and get into the questions. Here's the first one. It reads, "Hello. Firstly, I want to say I love your podcast and it helped me a lot. I also would like to talk about my problem with indecisiveness about getting a nose job. I have severe anxiety and I'm currently in therapy. I was born in a country where basically everyone gets a nose job, and I also wanted to get one from when I was a teenager. Meanwhile, I overthink so much that I canceled my surgery 3 times, but I really cannot get over this idea. I really don't know how to decide on this matter. I'm scared that it may turn out ugly or something, or I may turn out ugly or something is the way it's phrased." So yeah, that's the question. Thank you very, very much. This is one that I will not be able to give you perfect advice to, but I do want to at least provide my limited perspective and thoughts where I can. Hopefully it helps. You mentioned that you come from a country where basically everyone gets a nose job. I don't know which country you were referring to, but if we're just judging from the last name on your email, which I'm not going to share, it doesn't seem like a country or a culture that I come from. So please take anything that I say, anything that I offer in response with that in mind. I can't relate exactly to what you're experiencing. I don't face the same sort of pressures that you do. I don't have the same culture that you do. So my perspective is coming, kind of from the outside. But there are a few key points that I would like to highlight from your question. The first is that you have severe anxiety and that you're in therapy for that. Next is that you wanted to get a nose job ever since you were a teenager. And then the last one that I want to pull out is that you've had a really hard time going through with the procedure, having multiple attempts. So let's start with the fact that you've wanted this from a teenager. I don't know how old you are now, but I think you're implying that it's been a number of years that you've been wanting this procedure. That's valid, and that's good to know because that means it's not just an impulse decision. I have nothing in particular against impulse decisions. I know a ton of people with tattoos, for instance, that were gotten totally on impulse. Maybe they regret them, maybe they don't, but clearly they were young. They were just, like, hey, I want to look cool. Here's some tattoos. It's super cheap, whatever. But a tattoo is way different than plastic surgery, right? A tattoo can be laughed at. It can be covered up eventually if you want to. It can be blacked out. A nose job or other cosmetic facial surgery is a much bigger risk. So I think it does deserve more consideration, in my opinion. And, I think there might be some people that may try to dissuade you from getting the procedure at all, or that would try to pathologize you for feeling as though you need to change your body in the first place, right? They might say, well, maybe you need to work on your self-esteem instead of getting, plastic surgery. I'm not going to do that, right? My opinion about how you look or what you should do has no bearing here. It's your body, it's your choice, and you're allowed to do what the hell you want with it. But, I think that if you have always felt like this modification was necessary and you have the means to make it happen, there's no reason that you shouldn't. You are allowed to do that. However, I would encourage you to get in touch and make sure that you understand the why behind getting the procedure, right? So why do you want a nose job? Are your doubts about the surgery because it may not come out in a way that you're pleased with, meaning, the surgery may be botched and you might not like the way that it looks? Or are you having doubts because you're not really sure if you actually want to get it at all, right? These are two very different considerations. The latter, not sure if you want to get it at all, would mean that maybe you do need to take a look at, your self-esteem, your self-image as a whole. Why do you, want this, and why are you hesitant to get it? Do you feel like you must, but you don't actually want it? What's the deal there? If you have self-concept problems, it's possible that a nose job isn't really going to impact that. In other cases, it might, right? If you have a very, clear focus on the way that your nose looks, and that's the one thing that you really dislike about your appearance, then it could change that. The thing is, I just want you to kind of get in touch with that. Why do you want this done? I'm not saying that it's wrong, but why? And of course, it very well may not be the case. It may be the case that this is just something that would make you feel good. It feels more like the version of yourself that you would like to be. Something that aligns with the culture that you're born into. It's kind of a cultural norm, and that's okay. And it's just something that you've wanted for a long time. The thing is, even if all of those are true, anxiety doesn't give a shit about that. Anxiety doesn't care if it's something that's a good idea. It's still going to convince you that something is going to go wrong, right? And this is a tough one because, as I said, the stakes are somewhat high. I'm not a surgeon, obviously. I don't know a whole lot about cosmetic surgery and plastic surgery, but I imagine most people go into a nose job hoping that it's going to go right, that they're not going to have to revise it or get a corrective procedure done down the line. Like I said, that's one of the differences between getting, say, an impulse tattoo and an impulse nose job, right? It might be a lot harder to correct anything that doesn't go the way that you like. So there is a lot of pressure to get it right. And therefore, a certain degree of anxiety is actually appropriate here. It's necessary. And it's going to push you to do enough research and find the right practitioner to carry out that procedure. Now, we're going to continue with this question, but first let's take a quick break and talk about our first sponsor. All right, this episode is brought to you by OneSkin. OneSkin is a product that I have been very pleased to continue having as a sponsor because I really enjoy it. During the fall and winter times, my skin gets really, really dry. You can see it on my face. Like my face gets, a really harsh texture. My elbows, my T-zone, all of that. It's a mess. And it's really cool because I now have a product that can both address the hydration of my skin, but also the root causes of things like aging. Most skincare is really designed to just provide temporary relief, temporary reduction, and treat the symptom rather than the root cause. But by leveraging their in-house R&D platform, OneSkin has created their own revolutionary peptide that actually helps to reduce skin's biological age by reducing the number of senescent skin cells by up to 50%. They did a 12-week clinical study, and this was shown to actually strengthen the skin barrier, improve skin health markers, and diminish visible signs of aging in 87% of users. So it's a really effective product. I enjoy it. I think the packaging is great. It's refillable, which is good for the earth, and it's very easy to use. Just a couple pumps, rub it in morning, night, perfect. So OneSkin is the world's first skin longevity company. They address skin health at the molecular level. And if you would like to get started with your new face, eye, and body routine at a discounted rate, get 15% off at oneskin.co using the code DUFF. That's 15% off oneskin.co with code DUFF. All right, let's get back to the question here. As I said, anxiety is going to drive you to do a good amount of research, and that's probably something that you will want to do. But at a certain point, you've researched enough. And it sounds like you may be in this place. It sounds like you've done your research. You probably feel confident about the surgeon, at least in an intellectual sense. But your anxiety, your feelings, it keeps flaring up and causing you to cancel the procedure. If you haven't yet, you might want to check on this. You might want to check in with trusted loved ones or advisors to get their perspective on this, right? On the procedure, on the person, on the place that you're going to be getting it done. And make sure that they don't see any blind spots in your decision making, or that you've chosen a surgeon that isn't up to par, or something like that. It's not a bad thing to take time on this. You might feel a bit antsy that you've been waiting for a long time since you've been thinking about this for years, but this is something that presumably will be there for the rest of your life. So when you look at your life's timeline on the whole, taking a good amount of time, even if it's a number of years to make the decision to do it, you're probably not going to regret that. I really don't think you'll regret taking your time. And the fact that you have backed out several times only to pursue it again is probably a good sign. I think you do want this, but it's been difficult for you. So if you're in that place where you feel like you intellectually understand all of the information that you need, and you feel like the surgeon does consistently good work, then there probably isn't more figuring out and considering to be done. It's just more about how to help you move forward and get the procedure. And that means working on the anxiety component. You're already in therapy, which is fantastic. And there's a few other things that you can do as well. For one, having an accountability or support partner. It could be a friend, could be a family member, could be somebody that you just, hire like a life coach or something like that. But this is somebody who might pick you up and take you to the procedure and pick you up from it when you're done. This is somebody who's going to be bugging you about it, making sure that you have the appointment set, making sure that you're ready for it. And they would probably need to be aware that they might have to push you a little bit, even if you're anxious, to say, hey, we want to do this. Remember, this is what we talked about. Let me pick you up. Let's just go. Let's just try it out. Rather than just, waking up in the morning and on your own having a hard time and saying, okay, I can't do it, right? Having somebody else there to keep you accountable. You can also work on exposure. So exposure meaning getting some experience with the thing that makes you anxious. Now, obviously, you can't get actual exposure of the procedure because, you have to get it done to get that sort of exposure. But you could go to the facility that they're going to be doing it at and be there in person to talk to the doctor or just to be present. You could watch videos online about people that have gotten it done. You could even potentially talk to other patients who have had the procedure in real life if you have any ability to, contact former patients of theirs or, seek them out online or something like that. And then if there are any physical or logistical things that are making you anxious, like for instance, lying in a certain position, having, something placed on your face, any of these particular things, those are things that you could sort of simulate and help yourself, work through. For instance, keeping your nose plugged up with what swimmers use, those little plugs, I guess, that you put in your nose to block it up and only breathe out of your mouth. Maybe that's something that would be a good form of exposure. That's kind of a random example, but whatever it is that is tripping you up, maybe there's a way to get some exposure for that. In this case, I also think that visualization techniques might also be useful. So you could develop a visualization, walk yourself through a visualization in which you imagine that there was a positive outcome. You got the surgery, you recovered well from it, and now think about your life and think about the emotional experience of having this done and being able to live your life with this different part of your body. So kind of visualizing that and letting that pull you through. And then, of course, I think you also might want to remind yourself that you don't have to do this perfectly, right? You don't have to be like a good patient. You can go in there, be freaking the hell out, be so anxious that you're like on the verge of panic. But once they put you under anesthesia, that's going to go away, right? Your anxiety is not going to make the procedure not go well. So even if you don't do it perfectly, if you're able to get through that point, if you're able to get over that hurdle, then it will get done. So if there are things to consider in terms of why you want the procedure, please do those things. Give it the ample consideration. If you're unsure about how you feel about the cultural pressure to have a nose job, explore that in therapy and take your time considering what your actual feelings are. But if you know that this is what you want, then it's all about continuing the work on your anxiety and coping and just trying to get to a place where you're able to push through and get the procedure done. So best of luck to you. If you do end up going through with it, I really hope it works out well, that you have a good recovery and that you have a result that you're happy with. So thank you for the question. All right, before we get into the next question, I want to talk about our other sponsor, which is BetterHelp. It's holiday season, end of the year season, going through fall into the winter. And for a lot of people, that means an uptick in mental health symptoms. I was having this conversation with a therapy patient recently that even if you don't put a lot of stock into the holidays or you don't celebrate them, a lot of times there are memories related to family, memories about the state of the world during this time. And there's just more that is associated with this period of time in the year. And it can be a lot. So it's natural to feel some sadness, some anxiety, some new symptoms that aren't there for the rest of the year. And one thing that you can do is add a bright spot amidst all of the stress with therapy, something to look forward to, something to keep you grounded and give you tools to manage everything going on. So if you're thinking about trying therapy, give BetterHelp a try. It's entirely online, designed to be convenient, flexible, and suited to your schedule. Just fill out a brief questionnaire and that will get you matched with a licensed therapist, and you can switch therapists at no additional charge at any time. So find your bright spot this season with BetterHelp. Visit betterhelp.com/Duff today and get 10% off your first month. That's BetterHelp, HELP.com/Duff. All right, and on to the second question. This one reads, "Hi Duff, I've been listening for a few years and you've really helped me. I was in a bad place for a while, bad marriage, a child who was transitioning due to gender dysphoria, etc. I started therapy again because I was leaning on my kids and others who had their own problems and I didn't want to cause more problems for them. So my question is this. I was doing Zoom appointments with my therapist at the time. She was working from a WeWork type of space that was not very private. This became apparent to me when I heard a big group of people talking while we were having our appointment. She said there was a coffee shop in this space. I wanted to continue with our session, so I didn't mention it at the time. I thought a lot about this and how it bothered me that my session didn't seem to be private. I decided to confront her about this. In the next session, I said I wanted to discuss this outside of our therapy session. I asked her to tell me more about the situation. Maybe I misunderstood something. Her response was, "How did you feel when you asked me about this?" I feel like it was a deflection designed to take away any responsibility on her part that she had done something wrong. I was using a company that assigns therapists, so I was able to get somebody new that I really like. Problem solved, except I was never able to get any validation that my confronting her about the situation and her response was not valid. The new therapist was understanding about the privacy part, but it did not address that I tried to address the issue with the therapist, and it turned into part of my therapy and nothing to do with her. It isn't a huge deal because I solved my own problem. This has been a year ago. I know you're looking for new questions, so I thought I would throw this one out there to possibly get an answer to something that has bothered me. Okay, well, hello. Thank you for the feedback. I'm really happy to hear that my content has been able to be a part of, you digging yourself out of a bad situation. So that's great. Really proud of you for seeking out professional help and recognizing that you may have been putting some of the burden of your mental health on loved ones. So, thank you for recognizing that. And as I said, I'm proud of you for taking that responsibility. Your question is a good one. Essentially, it sounds like the issue is you were doing remote therapy with somebody and she was in a co-working space. So we work as a co-working space where everybody, pays a membership fee, and then there's office spaces that you can use there. So you're around other people in an office setting, but everybody's doing their own thing. So with that, there are other people not in the room with her, but, there's some question about how much can be heard from the outside of the room that she was in. This is a totally valid concern, and one of the biggest logistical hurdles when it comes to online therapy versus face-to-face therapy. Privacy is extremely important in therapy, both as a clinical issue and as a legal issue. When it comes to the clinical side, you're looking for a situation in which you feel comfortable sharing things that you don't share with other people. Maybe you're getting into issues related to trauma or your sexuality, things like that. These are deeply personal subjects, and nobody can blame you for wanting privacy while you discuss them. And then on the legal side, at least here in the US, we have very strict privacy laws that govern how we treat confidential healthcare information. For therapy, that means anything that's said within a session by you is covered under the HIPAA law. If people are able to clearly overhear what you're saying in therapy, that would be a violation of your right to privacy. Now, keep in mind, this has to be realistic, right? There are only so many precautions that you can take. If you see a therapist in a group practice or, say, a larger healthcare setting, there may be noisemakers outside the door or other precautions in place to help muddle the sound coming from the office. But realistically, if somebody wanted to listen in on your session, if they wanted to walk up to the door and, put their ear up there to try to listen in, then they could do that, right? It's not like we work in anechoic chambers where there is zero sound escaping. We just have to make reasonable precautions and try to do what we can. I think that being over telehealth can draw more attention to the ambient sounds, and depending on the particular software, sometimes it even amplifies them if it thinks it's a voice that's supposed to be part of, the meeting. But one thing to consider with telehealth therapy is whether your provider is wearing headphones. I always wear headphones when I'm doing therapy as a therapist. Because if you're wearing headphones, then, you can be pretty assured that whatever the patient is saying is not audible to people around them, even if what the therapist is saying in response is, right? So from the outside, they're not hearing you talk about, what you've been through and your relationship, etc. They're just hearing the therapist go, mm-hmm. So when he did that, you felt what? Frustrated, right? They hear the other side of it, if that. And this is kind of where HIPAA can get pretty complicated, right? So if the people in the surroundings can hear your therapist respond to you in a way that doesn't necessarily betray your identity, then I wouldn't say that's a violation, right? If they're just rephrasing, if they're just sort of providing validation, support, but they're not saying specifics that somebody outside would be able to identify you by, that wouldn't necessarily be a violation, but that's not something that you could exactly count on either. Now, aside from the privacy aspect of it, you as a patient, if you can hear people outside of the, therapy room, in air quotes, since this is virtual, if you can hear people outside of that room making a lot of noise, it can also just plain be distracting or uncomfortable for you. Right? So how are you going to open up about your deepest trauma that you've never told anybody in your life if you hear people, clinking glasses and laughing from the other side of the wall, right? It may be pretty hard to separate those in your mind. If you're like, okay, so when I was 10, okay, this is really hard. I'm sorry. My uncle, and then you hear, dude, I can't believe you did that this weekend, blah, blah, blah. You're like, okay, well, it's gone. I'm not going there. Right. So even if it's not a privacy issue, it may be a comfort issue for you still. And, I think that that's valid. You may be, having a hard time separating out what you're doing from what other people in the world are doing. And that wouldn't be very conducive to deep therapy. Now, I don't think it's impossible to conduct good therapy from a co-working space, but it does require some care. And for some therapists, that may be really the best option that they have. For instance, if they don't have a good environment for a home office, if they have, kids that are always at home or a loud dog or just not good space for it, maybe they don't have a brick and mortar location, like an actual office space that they can go to. So, they might have WeWork or whatever co-working space as their primary office. And that's, feasible. But there's also the chance that it doesn't work out, right? So maybe this therapist typically has a good amount of privacy during your appointment times, but on that particular day, there was just a lot of people there and a lot more background chatter than expected. But all of this is kind of irrelevant though, right? Because if things went down the exact way that you described, I feel like your therapist totally responded in a dumb way. When I read through this email the first time and saw the, how did it make you feel when you brought that up to me? I literally groaned out loud. I was probably like, what the fuck? Like, come on now. That is such a stereotypical shitty therapist move, right? Listen, there's nothing wrong with digging into feelings behind something like that. In my own therapy, I have asked questions like that, right? What was it like confronting me about that? But that's only after we actually discussed the fucking issue. That's only after we discussed the actual thing that happened. She was playing it right. She would have made sure that she understood and validated your concerns before asking about the emotional experience of confronting her with this totally valid concern. Because what she did sounded very invalidating. If it were me, I might do it like this. I might say, you say, hey, I wanted to bring this up. It felt like it wasn't very private. There was a lot of background noise and I'm just concerned about that. So I wanted to bring it up. I would respond and say something like, oh, okay. So like this co-working environment makes you feel like hesitant to share because it feels like maybe other people can hear you outside. It doesn't feel very private. Yeah, I can see how that would make you feel uneasy. Thank you for bringing that up. I'm sorry that that's been the experience. I definitely want to reassure you that like your privacy is very important. And I want to figure out a way to, make sure that you feel that you have your privacy. I wouldn't want to jeopardize that. I think maybe there's a possibility that it just sounds worse than it is on your side, but let's talk about it. Maybe we can figure out a way that we can make the situation more comfortable. I personally don't have another place that I can conduct sessions at this moment, at least. So, we'll talk about it. But if you let me know that there's no possibility of doing this, then, we might have to talk about other options since this is where I do therapy from. But I do appreciate you bringing it up, right? It's not that hard. You didn't do anything wrong by asking about this, right? There's no reason to make you feel crazy for being concerned about that. Just validate it, see if there's a good solution. And then after, if it's clinically relevant, then maybe I might ask you about that. I might say, so that was something that we haven't done before. How did it feel to confront me about that? How did it feel to sort of assert a boundary there? Especially if it's related to something that we've been talking about. If you've been working on boundaries or working on advocating for yourself, I might say something. I might say, hey, you know what? You did a pretty good job of speaking up about that. I'm proud of you. What did that feel like? So, right, it's tied into actually addressing it, not just being like, pew, deflection, like, well, how did it feel to ask me about that? That's like stupid bullshit. That reminds me of a therapist that being a TV show or a book. So yeah, you're not overreacting here. Maybe I'm overreacting, but you were totally in the right. So I'm glad that you found somebody else where this is not an issue. And to anyone who does telehealth appointments, please never be afraid to bring this topic up. I conduct therapy from my home office, which is where I also record the podcast. And I'm sure to let people know, if the kids are home, you might hear some background noise. If there's something, going on that they need to be aware of, I'll let them know that, hey, it is private. They can't hear what we're talking about out there, even if you can hear them. But please let me know if it's too distracting or if it's a problem, and just be real about it. And then on the flip side, for the patient or client side, I often talk to them about the situation that they're in when they attend telehealth appointments, right? Because if they're attending from work, I will ask what sort of privacy level they have. Or if they're at home and we're going to be talking about their partner or spouse, I want to make sure that they're not going to be overheard doing that. So I keep that in mind during session. For example, if somebody is attending from a conference room, like a big glass conference room at a big company, which definitely happens, I'm not going to try to make them cry, right? I'm not going to be like, okay, let's go deep. Let's dig at that thing and really bring up the emotion, because for most people that would be very uncomfortable. But I might talk to them about, okay, let's find a better time to do these sessions, because I feel like we're limited by the situation here. Obviously, you kind of have your attention split looking at people walking by and stuff. So just be real about it on either side, and I think it can work out. So I appreciate you bringing this up. Even if it was a year ago, I think it's an important issue that many people face these days, because a lot of people do telehealth therapy. And I hope that this gives you some resolution. Again, good job taking care of yourself. Good job speaking up about it, even if it didn't go anywhere. And take care of yourself. And with that, everybody, that is the end of the episode. This has been episode 375 of the Hardcore Self-Help Podcast. If you want the full show notes for this, go to duffthepsych.com/episode 375. And if you would like to send me a question for the show, shoot me an email to duffthepsych@gmail.com. And lastly, please, if you haven't yet, leave me a rating and a review on whatever podcast app you use. It's very helpful and I always appreciate it. Take care. I will see you in 2 weeks. Bye.